All right, so veins and arteries of the thorax. So now we're going to look at how blood goes to the head and the neck and the upper limb. Essentially, what you want to think about here is a couple things. Like here, we can draw internal thoracic coming like this, right? And this is anterior intercostals coming forward. Again, it would be the same on the other side as well. But what you really want to think about is here, this is the jugular notch. So coming out from the top of the jugular notch, you'll see an artery here, an artery coming up in this direction, and then another artery coming in that direction, basically, right? Here's the clavicle, here's rib number 1. We see how there's an artery that's going to come in that direction right there. Once it dips underneath the clavicle and past rib number 1, it's going to continue towards the humerus and down in that direction. We just need to make one other thing. So right here, I'm going to make a muscle. That is my teres major right there. It's going from the inferior angle of the scapula towards the humerus. So there's teres major right there, okay? So we just kind of have to like figure out what are our boundaries for each one of our blood vessels. Here, this is brachiocephalic. This is going to be left common carotid. This is left subclavian. Right there. Okay. This is brachiocephalic. Sorry if my writing is a little small. I'm trying to make sure you understand exactly where I'm labeling right there. And then this is right common carotid. Okay. As soon as you have right common carotid, this becomes right subclavian. So the boundaries for subclavian are basically where either it's going to come directly off of the aortic arch or on the right side between common carotid and brachiocephalic. Okay. And then remember, internal thoracic is coming this way off of subclavian. And then also coming off subclavian towards the back here is going to be vertebral. Just like that. As soon as the, I didn't mean to do that. As soon as the artery or the vein dips underneath the clavicle and past rib number 1, that becomes axillary. Okay, and axillary continues all the way to the edge of teres major. So basically, all of that is axillary. I know, it seems so big. It kind of is. Okay, I'll throw up another video from last year where we did all the branches off of axillary in case you guys are interested. I know you're not interested, but you can see if you want to. And then after teres major, this becomes brachial. So that's why the boundary of teres major is really important. That tells you where axillary is versus where brachial is. Okay. For veins, veins are going to be the same. The deep veins run parallel to all of this. It's all going to be the same. The only difference here is when you get to brachiocephalic, over here, you have subclavian and you have another brachiocephalic before you hit superior vena cava. So in this case, this is brachiocephalic, but this is also brachiocephalic. It's just the brachiocephalic vein. And then I'll do the neck one more time in another picture. I don't have enough room right there. But what comes off of subclavian should have a vein that parallels it, vertebral. Now we don't have a common carotid. Instead, what we have is internal jugular. Okay. Internal jugular is what is running parallel to common carotid, all inside of here. Because common carotid is deep and so is internal jugular. External jugular comes off a little bit farther back right here. And remember, it runs over sternocleidomastoid. Okay, so it's a much smaller vein in humans. And then if we continue, I'm just going to move this out of the way to see our upper limb. And I'm just going to start right about here, and I'm just going to keep going down. Okay. Once I hit my antecubital region for the arteries, they're going to branch and go left and right, basically, to thumb side and pinky side. Okay. So again, you can draw your teres major right about there so that you understand here is axillary. And then this is brachial. And then thumb side, remember thumb side is radial side. And pinky side is ulnar side. Oh, arteries, so easy. Yeah. For the deep veins, which I'm going to draw in a darker blue color, again, they mirror this. So we're going to see that the radial and ulnar vein basically run parallel to the radial and ulnar artery. And then once they get to the antecubital region, again, the brachial vein runs parallel to the brachial artery. And once you go past teres major here, it becomes axillary. Okay, so it's not anything different. The difference is what happens to superficial veins. Okay, so superficial veins are going to run over the muscle layer. There's going to be one that runs kind of on the shoulder side, and that shoulder side is towards the thumb side. So this you want to think about is over the muscle. So as it's running over the muscle, and then it dumps into axillary right there. There's also one that runs more on the pinky side right here. And when it runs into the pinky side again, it's going to dump into, it also dumps into axillary, okay? I need to just fix that a little bit. It has to dump into axillary. It's just that you're not going to see this all the way. It's a little bit deeper right here. It's not as superficial until it kind of comes out of the muscle. But this is cephalic. And this is basilic. Okay. The brachial is very deep. It goes between biceps brachii and triceps longhand. Whoops. And then going between the cephalic and the basilic, right here in the antecubital region, this is the median cubital. So the median cubital vein can kind of drain in either basilic or into basilic or cephalic. So again, as I was saying in like a previous video, you kind of want to think about how blood's flowing in specific directions, and you want to see how in terms of drainage, brachial drains into axillary, but so does cephalic and so does basilic. Okay, but that doesn't happen for arteries. So this is a different scenario. I should put this over here. That's a little bit different. Then when we come to the head and the neck region here, what I actually kind of totally forgot what I'd made these videos for what I had these images for last year, but I'm pretty sure it was to show us how what's going to happen is common carotid is going to go through, remember the transverse, not the common carotid. You're going to have a blood vessel that goes to the transverse foramen, and then it comes up here, and that's actually where, it's not going to come up to there. I'm sorry. You can't see the foramen magnum on this one. But again, all this for vertebral foramen right there basically coming into the back of the skull, you're going to have one vein and you're going to have one artery. And if we do this right, what you're going to see is like that's subclavian. So this comes off subclavian right there. This is vertebral. And then also coming up like right where that would be brachiocephalic, you're going to see common carotid. And then common carotid is going to branch and it goes up inside the skull and then comes up this way. So again, if you have common carotid is going to run parallel to the vertebral column. And then it's going to dive deep into there's the carotid canal, and it's going to come up and be superficial like that. So this is vertebral. And this is common carotid. This would be internal carotid. And this is external carotid. Okay. So same thing here, vertebral, common carotid, external carotid, internal carotid. Sorry, it's been a long day and I'm like pretty tired at this point, okay? For the veins, you still have a vertebral vein that's going to run parallel here. It's just that the vertebral vein dumps into subclavian. Where you have common carotid, this is going to be internal jugular, so it actually comes up and goes like that. And then you'll have a separate external jugular that'll come up like that. So where I have common carotid here, I'm going to have it dive into the jugular foramen right there. And then external jugular is going to be like way out here. I know that doesn't really work very well, but external jugular has to be superficial to the muscle. So here you need to see how subclavian has an internal jugular, an external jugular, and a vertebral. Excuse me. I'm just going to do this really quickly. Internal jugular, external jugular, and vertebral. There's 3 separate branches, and they all dump or drain into subclavian. Okay. Whereas when we have subclavian artery, we only have a vertebral. You'll have common carotid branching off separately. And then you have internal and external. Internal carotid and external carotid. You see the difference there? There's a difference in the patterning, okay? This is probably one of the things that is most confusing sometimes when you're learning it. There are 3 different veins. There is one common carotid and then 2 that branch off of it. Then there's a separate vertebral artery and a separate vertebral vein. Okay, sorry this video was not that good. I'll see if I can pull my other one from last year. I think I did a little bit better job. But I think even these 2 pictures were not the greatest.